We interact with people at their most vulnerable moments in their life that they never ever forget. So we try to anchor. It's very easy to get distracted by all the complexity that we deal with, but that really is at the heart of what we do every day and what makes it so meaningful.
Hi, I'm Chris Malone, and I'll be your host for today's discussion. I'm very pleased to welcome FeedbackNow as a new partner in our program. If you've ever seen the happy or sad face buttons in an airport security line, retailer, or restroom, those may very well be from FeedbackNow. And they're actually connected to a robust operations and data analytics network. This comprehensive solution takes real-time data from across healthcare operations and highlights where teams need to focus to improve patient experiences and reduce nurses' non-clinical workload. We'll hear a bit more about this later on. But in the meantime, I'd like to once again welcome Mandy Kilmartin, Director of Global Partnerships for Planetree, which is also a valued partner in our program. Planetree is a global not-for-profit organization dedicated to humanizing healthcare for everyone through excellence in person-centered care. Mandy, Planetree's Person-Centered Care Forum is coming up in October. Can you tell us about what's on the forum agenda this year and where we can find registration details?
Thanks so much, Chris, and hello, everyone. I'm excited to share that we are gearing up for our 25th annual Person-Centered Care Forum, which will be held October 6th through 9th in New Orleans. Our forum is one of the world's only events dedicated exclusively to person-centered care and cultural transformation in healthcare. The forum has a jam-packed schedule with lots of opportunities to learn, from inspiring keynote features to over 40 breakout sessions led by experts from around the world. There are also some fun events like a Mardi Gras-themed opening celebration and an awards gala, so it's definitely not an all work and no play situation. It'll be a great chance for healthcare professionals, from clinicians to patient experience officers to C-suite level executives, to connect with like-minded professionals and learn from their experiences. So on behalf of everyone at Planetree, I'd like to take the opportunity to invite each of you to join us in New Orleans this year to be part of this unique event. Registration and additional information is available through our website at planetree.org/events.
Thanks very much, Mandy. I'm looking forward to being there myself. And there's talk that we may even have a few Humanizing Healthcare live episodes from the forum. But in the meantime, what can you tell us about our guest today?
I'm really pleased to have the opportunity to welcome our distinguished guest, Mr. Lawrence Hamilton. Lawrence is the Executive Vice President of Performance with the Permanente Medical Group and the leading partner to CEO Dr. Maria Ansari. Lawrence supports the Permanente Medical Group's 45,000 staff members, focusing on translating the organization's strategy into performance through innovation, continuous learning, and performance improvement. He's also deeply immersed in efforts to advance the next generation of healthcare leaders through sponsorship with the Permanente Administrative Fellowship Program. And we're thrilled that he's taken the time to be here with us today. So with that, I will turn it back to you, Chris.
Thanks very much, Mandy. And welcome, Lawrence.
Great to be with you, Chris and Mandy, and all of our viewers.
To get us started, how did you find your way into a career in healthcare in the first place? Is there a story about that you can share with us?
Yeah, so you can probably tell from the accent, I grew up in Britain, and I was finishing up at Oxford, and in Oxford I did politics, philosophy, and economics, and I worked out that really the underlying theme was what can we do to make society flourish, which sounds very grandiose. I was an undergraduate and graduate, and in Oxford the hospital sits on top of the hill, and it was late at night, and all of the lights were on. And this sounds cheesy, but it's true. The epiphany I had is the lights are on because the most vulnerable people from the community are in that building because they're sick. Illness happens 24/7. And that building is full of people whose vocation is to look after people when they're sick and vulnerable. That felt like a wonderful microcosm of a metaphorical and literal healthy society. So that drew me to apply to the Administrative Fellowship Program in the UK with the National Health Service. And I suspect, like some people know exactly what they want to do when they're 14, and that wasn't me. So I started thinking, let's try this out. And I've never had a dull day. It's always felt very purpose-driven. To begin with, very interested in strategy, systems, policy, and then increasingly through my career, interested in people. And what does it take to engage and empower people so they feel inspired, can do their best work, deliver great healthcare for the patients and the members that we serve, and go home feeling incredibly proud, fulfilled by what they do. So that's that was my entry into healthcare, and I've always felt incredibly privileged to be able to do a role where you're surrounded by people who share a similar vocation and are inspired and driven to deliver great health for the patients that we have the privilege to look after.
Well, that sounds really wonderful. And you mentioned something that makes me realize what's more personal than healthcare, right? It's at our times when we are most needy and most vulnerable, and we have the greatest impact on others. And so that's a really nice background. And so, fast forwarding, what does your role as EVP of Performance encompass at the Permanente Medical Group?
Yeah, the Permanente Medical Group, we have the privilege to care for 1 in 70 people in the US, as part of Kaiser Permanente that cares for 1 in 30 people in the US. And as you probably know, Kaiser Permanente and the Permanente Medical Group deliver comprehensive care. Our members tend to stay for years whenever they can. So we serve a very diverse population and have the benefit of developing trust with them and caring with them for years. That enables us to deliver both, I think, outstanding individual patient outcomes and outstanding population health outcomes. So typically, TPMG, the Permanente Medical Group and Kaiser Permanente members have a 20% less chance of dying from cancer, a 30% less chance of dying from cardiac disease, 40% less chance of having a stroke. Our colleagues at Mid-Atlantic did a study where, on average, our members live 6 more years than the population who don't have the benefit of our care. And for our African American population, it's 9 years longer. And so feel incredibly, in terms of why do we come into healthcare, to be able to deliver those sorts of outcomes. And in terms of my role, as Mandy mentioned, I partner with our CEO, Maria Ansari, an organization of 55,000 colleagues, including 10,000 physicians and 45,000 other clinicians, nurses, staff. And the way I think about my role is success equals, do all of those 55,000 people feel respected, seen, valued for the unique contribution that they bring to deliver care? Do all of those 55,000 people believe in the direction that we're taking? If it's left to their devices, this is what they would want us to do. And then can all of those 55,000 people in their daily work make stuff better? It's one of the most intrinsically rewarding things, I think, to not only care for the patient in front of you, but also make things better for the team and for the patients that we have tomorrow. And we want the people closest to the work to be driving improvement. So if we can, in grandiose terms, if we can align culture, strategy, and our sort of operating system to improve all the time, then we're doing good work. And we try to bring it together. It's a large, complex organization. So another way of sort of simplifying it, can we all work towards one plan? Can we act as one team? And can we speak with one voice? So that's really where I spend my time, trying to think about how we can get better at doing that all the time, each day.
Wow. Those mortality and clinical outcome statistics are really remarkable in and of themselves. But I think even more remarkable to me is you have the ability to calculate them. And the fact that you are both a healthcare provider and a payer, I imagine, is part of why you're able to have such comprehensive insight on the patients and members that you serve. Is that right?
Yeah, that's absolutely right. Yeah, and I think as we go further into the conversation, sort of unpacking, as you say, at a surface level, we talk about health plan, hospital, and medical group all being one. That's undoubtedly true because we're not fragmented, we're not competing with one another. We're always intentionally seeking to integrate, to collaborate around the best population health as well as individual outcomes. And then I think if you unpack that a little, it's all about, can our primary care physicians earn the trust of our patients and then invest heavily in preventive care? Then for patients who do need specialty care, can we make sure we're right-sizing that specialty care and hospital care to serve 4.6 million people? That's also attractive to our specialists because then they're not hunting after work. We're using them at their top of skill, top of license, and so they get to do what they do best more frequently than often in the world outside. And it means that we're not over-investing in the hospital and specialty care that we know is more important to people's health, but is also the more expensive part of the healthcare delivery system. So whenever we can go upstream and prevent illness, that's what we strive to do, and create that and trust with our patients, because we know that's crucial to helping them live their best lives and avoid downstream illness.
Well, certainly a very unique organization. Now, you mentioned, that you started your career back in the UK, and that along your career journey, you served as deputy CEO for an NHS hospital group in London, and then later as CEO for Aga Khan Health Services in Tanzania, which I imagine was a little different. And I'm wondering, how did those experiences inform, your approach when you came to the United States to work with Permanente Medical Group?
Yeah, thanks, Chris. It was actually towards the while I was in Tanzania, I asked myself, what seems like an obvious question, but I hadn't asked it before, is which health system comes closest to what I'd create if I had a blank sheet of paper? And that's what led me to apply to Kaiser Permanente back in 2004-05. And at that time, actually, the Kaiser Permanente's reputation outside of the US was probably more well known and of higher repute than it might have had within the US. Permanente medicine sort of claim to fame was around chronic condition management and producing outstanding population outcome. And then also at that time, lots of hospital systems were developing electronic health records that were really focused on trying to get hospital departments to talk to one another. Kaiser Permanente was the only system that I was aware of where it was not only doing that, it was doing that, but also enabling patients to email their physicians. This was back in 2004.
Wow.
So a good 10 years ahead of most, and also giving patients direct access to their medical records. Now, of course, emailing our physicians has become both a wonderful thing for patients often, but also has overburdened many of our physicians. So we need to recalibrate that to take the benefits of that, but also build more robust systems around it. But it felt like next generation use of technology. And then as I got to know the organization better, sort of trying to create the real intentionality about creating a place where health professionals can do their best work. So that felt like a compelling, and as you said earlier, the sort of the evidence around delivering extraordinary population outcomes, what we'd want every health system to be focused on doing, is what drew me to the Permanente Medical Group and Kaiser Permanente. And like all of us, I think every day you see opportunities where we can do things better. But when I stand back and think about what motivates me, my sense of purpose, and what I think healthcare systems should be striving to do, I think like many of us, we believe that we've got a huge contribution to make to the patients that we serve, but also an ambition to be able to bring Permanente medicine and Kaiser Permanente to more communities.
Amazing. I've been told that some patients, when they immigrate to the United States, experience a kind of healthcare culture shock. And I wonder if you experienced any of that, or perhaps because you were going to the Permanente Medical Group and the innovative approach that they have, and the fact that they are both a provider and a payer, maybe that kind of minimized some of that, and that by choosing them, you were able to kind of sidestep what perhaps patients sometimes experience.
Yeah, well, partly as a patient, partly just as a person, partly as a healthcare leader, did have culture shock. When I was in Tanzania at that time, it was pretty frequent to run out of water or run out of electricity. I remember we started the first MRI service ever in Tanzania as a nation.
Wow.
And I remember getting a call from Nairobi airport to say that when they'd sized, it was coming from a big plane into Nairobi and a smaller plane from Nairobi to Tanzania, and that they had sized the plane for the Nairobi to Tanzania, forgetting the packaging that would go around the MRI machine, so it didn't fit. So my choice was, I was chief executive at the time, so the choice was, would I like them to take off the packaging of the MRI and do their best job to sort of rope it into the plane so it wouldn't shake around too much? Or would I choose that they bring it by road over the sort of Tanzanian and Kenyan potholed, bumpy roads? So that's just an anecdote. The point is that when I came to the US, I was shocked, not shocked, just what I had to get used to was abundance. And what that translated into as the healthcare system, accounting for 17 to 18% of GDP, we have an abundance of resources. And so how can we use those resources to have the best possible impact on the patients that we serve, the communities that we serve? And I think we're all aware that by any international comparison with other developed economies, we don't have much to be proud of in terms of our outcomes. So that was my culture shock, was sort of getting, if you live in a country, a less developed economy, the people that you're surrounded with are brilliant, frugal innovators, have amazing creativity, amazing resilience. And not to say that we don't have that in the US, we have that also in abundance in the US, but how do we really take advantage of all the resources at our disposal? And I have this idea that in some future life, I would love to twin, we have lots of physicians and clinical teams who work in less developed economies. What we've had much less track record is of taking systems like the Permanente Medical Group and Kaiser Permanente systems, so that it's not just the individual clinician, but it's also systems. And I'd love us to twin with some other systems, partly because I think we have something to offer, partly out of all humility. I think we've got a lot to learn about, as I said, frugal innovation, creativity, and hopefully by that partnership, we'd learn a lot, we'd offer a lot, and we'd be able to leverage some of our skills and experience to help a broader population. Anyway, that's for another chapter.
Well, that would be an interesting exchange program. It sounds like a great idea. Now, I understand that you also have accountability for wellness, equity, inclusion, and diversity efforts at the Permanente Medical Group. And as many healthcare providers are endeavoring to become more equitable and more responsive to diverse populations, I wonder what you are learning about how to accomplish these things in your organization.
Yeah, I've got 3 points to make on this topic. The first is around equity. Absolutely core to Permanente Medicine and Kaiser Permanente. And it fits absolutely with that population outcome, ambition, aspiration, and mission. And the reason we developed many of those great outcomes is by developing programs that help general populations. And we're very proud of that. And we recognize that to defeat health inequity, we need to go beyond that and add and supplement and redesign parts of our programs to meet the specific needs of underserved communities. And so that's part of our work, and we've made some superb progress of actually eliminating health disparity for colorectal cancer for our Latino population. Really strong progress around hypertension control for African American population, and we still have far to go to eliminate healthcare disparities. So that's the first, is the using our systematic approach to healthcare improvement and prevention, and targeted to underserved groups. That's the first. The second point I'd make is developing a diverse. We know diverse organizations perform better. I think the evidence is absolutely clear. So what do we need to do to make sure that our healthcare professionals reflect the populations that we serve? So we've been pretty intentional around trying to develop pipelines to make sure that where we're underrepresented, we boost that. It obviously doesn't happen overnight, but we've had some success in making progress towards making sure that our physician and employee population reflects the communities we serve. And the third topic is around social health, because we know that social determinants of health are about 70% of health outcome. And I'm really proud of the work that we've done as Kaiser Permanente to invest in housing, in education, in legal support, in financial support. And I think there's a further opportunity. We've tended to do that through our community benefit part of our organization. I think there's a future chapter where we fully integrate some of those social health interventions into our delivery system, so that we fully integrate physical, mental, and social health, so that we can address those drivers of health in a comprehensive way. We've got some great pockets of doing that, but a way to go before we can truly say that we've integrated all of those dimensions in the work that we're doing.
Very interesting, particularly the social aspects of this. I think, as you know, one of the kind of basic premises of this program is that as healthcare organizations have become larger, more digital, more focused on efficiency and costs, care experiences for some are feeling more transactional and personal and disengaged for both patients and clinicians, kind of fraying that social interaction, if you will. And I'm wondering if, what your thoughts are on this, and whether some of your performance improvement work connects to or addresses some of these type of themes.
Yeah, the other day I was giving a talk, and as I left, we had a volunteer who was supporting the meeting, giving out packets as people arrived, etc. And as I left, I thanked him, and he said, "I'll do anything you want me to do." I was sort of taken aback by just the sort of absolute generosity. And I said, "Tell me more. Why is that?" And he said that 40 years ago, his wife was giving birth to their first child in one of our medical centers, and it had been a really difficult delivery, where at one point he was warned that neither mum nor baby might survive. Fortunately, both did. So he said that was a first mini story. The second story was that 10 years later, his wife had breast cancer, and she'd had care from one of our other medical centers where we focus on tertiary, on complex cancer care, and that she's now part of our survivor program and recovered really well. And then he said that 3 years ago, he'd had a STEMI heart attack and had got taken to one of our hospitals and a stent put in. So he said, and he welled up at the time, sometimes I do as I tell the story, he said, the three most important events in my life and the lives of the people I care for most, I owe my life to you.
Wow.
Excuse me. I tell that story often because, as you say, in large organizations, when we're caring for 4.6 million people, what we do can become routine. And exactly as the premise of your question, us all connecting with we interact with people at their most vulnerable moments in their life that they never ever forget. So we try to anchor. It's very easy to get distracted by all the complexity that we deal with, but that really is at the heart of what we do every day and what makes it so meaningful.
Wow.
To your question around health systems becoming impersonal, I want to be careful that we don't romanticize the past. You could characterize the healthcare sector as a cottage industry for a long time, which did feel very personal, but absolutely not fit for the future or fit for the present in terms of quality outcomes. We know that medical knowledge, if it doubles every 7 days, it's impossible to deliver high quality care on a fragmented, isolated, small basis, even though that might feel very personal. So we want to take advantage, I think, of technology, evidence-based care, clinical trials, and embed them so that healthcare professionals have at their disposal all the benefits of that information and support so they can do their best work, while at the same time not doing that at the expense of a personal connection. So I think that's one way of characterizing where we are in healthcare. Take advantage of all of the things that scale and technology can bring, and use it in a way that enhances our ability to make personal connections. Recently, we've implemented ambient listening it's currently being used by about 8,500 physicians and clinicians. on average, it's saving an hour per day of pajama time. As importantly, instead of the exam room feeling like it's the physician and the patient with the computer in between, we've now restored that sense of direct connection with the computer behind. I think that's a great example of technology really helping us to make healthcare more personal, while also relieving us of burdens of documentation. That's just one example. I think we have hundreds of examples of trying to bring the full body of knowledge to physicians and the clinical team at the point at which it's most useful to them. That sort of predictive analytics and augmented intelligence is going to be invaluable for us to be able to deliver outstanding quality of care. So it's that balance of using technology to enhance what we do, not to compete with the personal nature of healthcare.
It's an excellent point, to find the balance, right? That yes, we need to have that personal connection and that relationship, that trust that comes from all of those positive outcomes. But we also want to make sure we're leveraging the best technology, the best medical science as well. So that seems like a great spot to just take a quick break. I would like to share a little bit more information on FeedbackNow. And so let's take a look at this, and we'll be right back.
Ready to revolutionize patient care? Real-time operations can transform healthcare's human aspect. FeedbackNow's comprehensive solution uses instant data from across your operation to highlight where teams should focus for faster patient service, reduced staff burnout, better noise management, cleaner public facilities, and more. From parking to discharge, every touchpoint can be optimized in real time. Join healthcare leaders creating wow moments with personalized care. The future of healthcare is here. Don't be left behind.
So thanks for indulging us that. I've actually seen some interesting things from FeedbackNow. They're doing some remarkable things with Montefiore Health in the Bronx that is having a real impact on the workload of nurses and kind of shifting those non-clinical activities off their plate. Let's get back to our discussion. What are some of the more recent or current performance improvement projects that you have going on at the Permanente Medical Group? Anything you can share with us in particular?
Yeah, I think I'll share an example of trying to use predictive analytics and augmented intelligence. We all know that a relatively small number of people account for a disproportionate amount of cost because they're complex, they're very vulnerable, and they have, as I say, very complex needs. We developed a program, one to scour our electronic medical record to identify those people early, and then enroll them in a team that's still focused on their primary care physician, because that's the most trusted anchor point within the health system, but also acknowledge that that primary care physician isn't going to have time to be able to handle all of the complex needs of that patient. And so we surround them with a support team. Originally, that support team was able to have essentially a panel of about 300 patients. So that gives you a sense of the intensity of the care. But we saw some outstanding outcomes in terms of healthcare benefit, as well as using our system as appropriately as possible, optimally, and supporting them to live healthier lives at home. Then it got even more exciting, I think, that we worked out the technology to identify when any of those patients had an acute event, and then serve them to the most appropriate person on the team, rather than going generically to the team as a whole. And then when they've recovered from that acute event and they go back to monitoring, we can then take them off of the panel of that patient and put them back into a sort of monitoring status. And that enabled us to go from an overall panel of 300 to a panel of over 1,200.
Wow.
The reason I'm so excited by that story is because not only clearly the whole program is great for patients, great for patient outcome, great for, we know, don't we, when patients have very complex needs, navigating health systems, we struggle with this as an integrated system. When I talk to friends and neighbors who aren't part of our system and the struggles they have navigating isolated specialty care practices and getting everybody to understand the plan is just extraordinary. But even we struggle with it. And sometimes our patients say, I keep being called by different people Can you get better coordinated so that I'm not getting multiple calls on the same day? So what this system does is enables us to do that better. And the second thing is, in terms of the healthcare professionals involved, the idea that you're getting called on when it's your expertise that is critical to that patient. When I look at how patients get discharged from hospital and do one of those sort of spaghetti diagrams that tracks the patient, the amount of heroism required by so many health professionals on an hourly basis in hospitals, in emergency rooms, throughout the system, it's exhausting and frustrating. And it shouldn't rely on heroism. So our ability to use technology, but not just rely on technology, also bring teams together to really understand clinical workflows centered on the need of the patient, so that health professionals know that what they're contributing is the unique contribution that their skill set, experience, expertise brings. So it has a huge benefit, I think, in terms of professional satisfaction for the health professionals involved, great outcomes for patients, and in terms of resource stewardship, clearly just a dramatic improvement in terms of the resources needed to care for the most complex patients. So I share that as one example. We're intrigued about how we take that example and extrapolate or redesign using the same principles, but for other populations under our care. You know how often when we talk about precision medicine, our mind immediately goes to complex cancer care. And clearly, that cancer care is transforming almost every day. And so precision medicine is a wonderful advance. I'm intrigued by the concept of precision primary care. And to what degree can we understand our patients, use predictive analytics? We have a large division of research that has the benefit of longitudinal data that's clinically defined rather than defined by payer, that is a very diverse population. Leveraging that data and large language models to provide predictive tools. We've done some great work in the hospital where we can predict patients that are going to deteriorate fast before they go to the ICU or in the ED, and we save about 500 lives per year for our population by being able to anticipate 24 hours in advance when somebody's going to deteriorate, put in place the team, and help that patient. Can we move that sort of thing upstream and help more patients in terms of predictive care? So that's some of the work that we're actually doing now and is in place, as well as the promise of more work in the future.
Fascinating stuff you're working on. Fascinating stuff. Let's take a couple of questions from listeners. We have a question from Mary, and she's wondering, what is Permanente doing, if anything, around integrated holistic care principles, and integrating those into medical services, whether it's prescriptive nutrition or Eastern medicine or things like that? Anything like that going on?
Yeah, I talked about challenging ourselves to integrate physical, mental, and social health, which I think is sort of in line with the question. We pride ourselves on being evidence-based, and we know that sometimes the evidence is skewed by economic interests. And so we need to have a broad and curious mind around what different interventions help. I'm always intrigued. I note that we often talk about lifestyle medicine and social determinants of health as two separate topics. And essentially, I think that we tend to talk about social determinants of health in the context of underserved communities. And often we talk about lifestyle medicine in the context of very well-served populations. I'd love us to sort of get beyond that categorization. And the common theme is, how do we help people live healthy lives and connect with different communities, with where they're at and what their challenges are, and help them to overcome those challenges. That's the sort of mindset with which we're approaching care. And lifestyle medicine often brings to bear clearly nutrition, sleep, healthy lifestyle, people having agency over their own journey, both in their life and health as a key dimension to that. I think is a natural fit for our approach to care. So I hope that helps address that question. Thanks for the question.
Absolutely.
It's a great one.
We have an interesting philosophical question from Jake Poor. He says, do you think the KP founders would be proud of the systems that you've created for high quality, low cost prepaid healthcare? Ever reflect on something like that?
Yeah, I think that we actually had one of the execs from Microsoft come talk to us about the work they're doing in artificial intelligence, and they know us very well because this individual sits on the School of Medicine board, the Kaiser Permanente School of Medicine, and has worked with us in various with various different hats on. It's interesting as he finished his talk with us, he said the thing that stands out to him about Permanente Medicine and Kaiser Permanente is our lack of FOMO.
Yeah.
I read that as us really being very true to the spirit of the founders, that core around providing preventive primary healthcare as really the foundation stone of what we do, and that it's the right thing to do to drive population health. And we have a business model that supports that rather than at the expense of our business model. I think our founders were really courageous. And so they would be, I think, challenging us to be equally courageous. That we've had a great track record of providing care for many, many people in California. And we've had a much more mixed track record in providing care to other populations, communities beyond the West Coast. And so I think we're both proud of what we bring to that conversation and believe we have a big contribution to make, and also humble about how we translate the contribution that we have to make to a multi-provider, multi-payer community that exists in much of the US. And we were very, very early adopters of technology and trying to use computers back literally in the late 60s to support care. So I think they'd be challenging us to say, there are huge opportunities being created through augmented intelligence and predictive analytics. How can we use them to be on the forefront and support our healthcare professionals throughout the system in delivering the best care and creating the environment for them to do the best work?
Very helpful. We are just about out of time, but I did want to just sneak in one more for you, Lawrence, and that is, do you have a favorite quote you can share with us? And if so, what is it and why is it your favorite quote?
I'm going to, if you don't mind, break the rules slightly and share two quotes.
Very good.
And I think they'll be self-evident. So one is from Nelson Mandela. It always seems impossible until it's done. And then second, somewhat related, is from Helen Keller. Alone we can do so little, together we can do so much. I think as I started, I think many of us in healthcare share a profound sense of purpose about why we chose to work in healthcare. And that really to grow human potential, both in terms of our patients and also in terms of the health professionals we get the privilege to work alongside. Finding an opportunity where we can really deliver on that sense of purpose seems to me what many of us that came into healthcare are really striving to do and contribute.
Thank you for sharing that. We are so appreciative that you were inspired by that hospital on a hill. You and your colleagues are doing such good work. It has really been enjoyable and interesting, to talk with you today. Thank you so much for your time and insights that you've shared. For our listeners who may want to be following what else is going on at the Permanente Medical Group, is there a particular place or way that they can kind of follow or stay connected to what you're doing?
I think the easiest thing is either both me on LinkedIn and also the Permanente Medical Group and Permanente Medicine on LinkedIn is probably the easiest way to do it. It's been great to join you, Chris and Mandy, and thanks for hosting this series. I've listened to many of the podcasts and they're always illuminating and a great opportunity to learn from other colleagues doing superb work.
Well, thank you for contributing so much to it today. To our listeners, thank you as well for joining us. We hope you found this informative, inspiring. And then finally, I'd also like to thank the good folks at FeedbackNow for sponsoring our program today. And be sure to join us next month for our next Humanizing Healthcare discussion with yet another healthcare leader and innovator.